Hello, and welcome to Module 4 tutorial, Nursing 653, Healing Environments and Practice, the Holistic Assessment. I'm Kim Blumenfeld. I'm the Clinical Instructor for the RN to MSN Clinical Systems Leadership Program at the University of Arizona College of Nursing. So what is the purpose of this assignment, this new way of approaching disease? Well, we're going to make the switch. We're going to be moving away from the biomedical model that we all learned in nursing school to Engel's biopsychosocial, the BSP model of assessment. I'd like you to first read the Holistic Caring Process from Holistic Nursing, a Handbook for Practice in its entirety before creating your assessment guide. This chapter is in your required readings for Module 4. A link will take you to that chapter to read. In the recommended readings, I suggest you read the Epstein 2014 article that beautifully explains Engel's vision of patient care. This assignment will either reinforce how you assess your patients or will give you the opportunity to practice the BSP model of assessment. Epstein 2014 stated, George Engel's biopsychosocial vision was simultaneously scientific and humanistic. These challenges are magnified by the mandate for greater patient autonomy and participation in care, increased access to information, and the overlapping and omission that is done when multiple professionals try to address the whole person. Importantly, trainees and clinicians get stuck implementing the biopsychosocial model partly because they have not developed the capacity for their own resilience, self-awareness, and self-monitoring. These capacities of caring for themselves must accompany efforts to help clinicians engage more deeply with their patients. Otherwise, they risk emotional distress, empathic failure, premature closure, and withdrawal from effective connections with patients. This is a true statement to think about because I think we have all experienced the chaotic times of caring for patients, especially now in this day and age. So by using this model, your patient is no longer the chief complaint that they entered your clinic or hospital for, but a complex being where disease enters your patient through an unbalanced mind, body, and spirit. Holistic assessment involves the healthcare provider to share an energetic space and professional interaction. You, the nurse, suddenly sees the patient beyond their diagnosis. You instead listen for cues to why they present with the illness that they have. We all are, after all, complex living systems. The first step is going to be choosing a case study. You'll choose from 4 different case studies. I'll review them below. You'll have a choice between a Korean adolescent with inattentive attention disorder, a 25-year-old gay Hispanic man with persisting fever, a 42-year-old Caucasian man with a history of myocardial infarction, or a 72-year-old African-American woman with diabetes, hypertension, peripheral vascular disease, and a wound that will not heal. I encourage you to choose a case study that may make you feel uneasy or unfamiliar with. If you do this, you will get the most out of this assignment through the research you do to set up for your video assessment. If you do this, you will experience your triggers, your gut reactions that sometimes interfere with the openness needed to hear and heal your patient. Own these triggers. Feel them deeply. If you do, then you will become a holistic nurse. It may seem strange that we are asking you to find an actor for a specific part. We do this for a purpose. We are all humans and mostly likely to stay within a comfortable lane, so we may choose the patient we see most often. It's easier to complete the assignment, get it out of the way. But this course is different. We are asking you to get uncomfortable. I would recommend you choose a healthcare colleague, but in the end, this is your choice. Remember to get their signed consent that is provided to you in the course. This consent must be signed and submitted with your final project to the Dropbox. If it is not, then your project cannot be graded. You can use whatever media recording you want. D2L provides you with YouTube instructions, but you can simply create a recording with your phone or computer and submit that format, for example on MP3 or MP4. And be sure to check your submission link to be sure it opens and works when you submit it to the Dropbox. If you cannot open it and use it, then your faculty member will not be able to either. Also, keep in mind that downloads to YouTube and sometimes downloads even of your presentations to your own computers can take hours to be done depending on your internet speed or how many people on YouTube are doing it at the same time. So don't wait till the last minute to download your assessment. You can script your volunteer or allow them to answer your questions how they think this particular patient would answer. This is a growth opportunity for them as well, to present themselves in an unfamiliar skin. And then practice at least 3 times before starting your final video recording. So again, look to your colleagues or family or friends willing to take on the patient you choose. Give them a case study for them to review. You're going to guide them through a video assessment, and they can answer what they think this patient might say, or you can provide them with a script. And again, practice, practice, practice. This course provides you with a holistic assessment template. Isn't that nice? This is going to make your job a lot easier. It's going to be a fill-in-the-blank kind of process. Of course, you'll have a lot of research to do, but this will help you organize your thoughts. So please use this template for your assignment. I'd like you to have a copy of that holistic assessment template in front of you as we are going to renew it. We're going to review it section by section. So if you need to pause this presentation for a moment and go grab it, that would be great. Do that and then rejoin us. In section 1, at the top, you will simply add in the information asked for, your name, the case study you choose, and copy and paste your video link. In section 2, this is the guide you will fill out once you have researched the patient's type in the case study. This entire section is theoretical since this is not an actual patient, so research well, not only the disease, but also the demographic details. Notice that each system is assessed using the Angle model, remembering the patient is not just a body expressing symptoms, but also has contributing psychosocial spiritual components. The concept map is also on your template, and we're going to review that on the next slide. Lastly, write a 2 to 3 paragraph summary of your findings, and then after that, be sure to include an APA formatted reference list. Here we have the concept map example that I put together to try to walk you through how to use this. So after you've assessed the patient, you've gotten all the information that you can from them, you're going to fill in the boxes of the concept map that is provided to you on the template, the holistic assessment template. The concept map is not only a place to fill out your findings, but you will be sharing with your patient on the video your holistic plan. Again, you will not only write these findings on your template, you will be educating your patient on the video with your plan. So, it will go something like this. Pretend that I'm the nurse that's assessing the patient, and now I'm going to sit down with them and give them their holistic plan. So, Ms. Smith, you came in today reporting you are depressed. Your doctor has examined you, and he and I have consulted on a plan beyond just the typical medication treatment. I can emphasize with you how difficult this time must be for you. Fatigue, foggy thinking, withdrawal can feel insurmountable. We are recommending you start by making an appointment with a therapist of your choice. Here's a list of names that your insurance allows for you to consider. Certainly, if you have already seen the therapist you trust, please make an appointment today to see them again. If you are at all able, take some time off from work and rest. Spend some time in nature. Take a daily walk to start with. If you cannot take time off work, start by simply sitting quietly each day for 5 minutes. Play some music you like. Close the door and ask your family not to disturb you. Create a healing space, even though you may think 5 minutes is no time, or that you cannot possibly fit in even 5 minutes for yourself. You must take some time to care for you. You are the most important during this time of healing. Do this on the job also. This may be the most important part of your day to detach for short periods of time. Try to get away for 5 minutes here and there. Try very hard to disengage from gossip and negative thinking with your coworkers. Practice what you may tell them when this happens. For example, Carrie, I've decided to take a break from workplace politics this month. And then as you get stronger, more confident with how you feel, you can say, Carrie, I'm not going to be part of office gossip anymore. I'm working on seeing the positive in others. It really is the only thing that I have personal control over. You tell me that you are not a spiritual person, but are looking for some kind of group or community to fill your needs. That is important. Being around other people and socializing, having a common purpose, will help heal you for sure. Community is very important, and it can be so nourishing, but it cannot give you all the answers. Those must come from within yourself. Take these next 4 weeks before we see you again to see your therapist weekly, to rest, walk, sit quietly, and reflect. The medications we are starting you on could take 4 to 6 weeks to show effects, so don't get discouraged. Fit in small things to nourish you, even if that small thing is 5 minutes alone. Here's our phone number that will connect you to one of our team members 24 hours a day. Never hesitate to call. We will see you in 4 weeks, and during that time, be kind to yourself. Here is a copy of the holistic plan that we just went over. And again, give us a call if you have any questions, or come back in to see us. Also with MD2O, we give you a holistic assessment exemplar. This is an example, a walkthrough of how you would perform during the video assessment that you're doing. So the most important thing during this assessment and in your professional life is when you see a patient, you walk into the room, whenever you encounter them, it is important to welcome them and introduce yourself and what role you have. There's really nothing worse than a person that, comes into the exam room and doesn't say who they are, what they do. You don't know anything about them, and they're asking you to take their blood pressure, and they're asking you personal questions, and you don't even know their name. So please, if you do anything at all, this is the most important thing that you can do for your patients. Introduce yourself and tell them the role that you have in taking care of them. Then you want to sit down. You want to tell them how much time you're going to have for this interview. And that could be 10 minutes for the interview and the assessment. And while you're doing that, take a look at your patient. Do that general survey. Take a look at them. How are they dressed? Are they neat and clean? How does their hair look? How is their expression? Different things that you may pick up about them that either look pretty okay or maybe seem a little bit awry. When you're talking to them, use open-ended questions and watch for any nonverbal cues in body language. Their diversion of eyes or their shifting in their seat, things like that may not be cultural in nature, but truly look like they may be uncomfortable in telling you. You want to go through your whole biopsychosocial story, so You're not only going to be assessing them physically, but also be asking them questions about their spirituality, how they feel psychologically. Are they depressed? Are they happy? How do they feel? And also, you're going to ask them Let me back up for a minute because I lost my mind there for a second. But anyway, as you're asking them those open-ended questions, remember that you're going to go through the whole biopsychosocial story. So not only will you be doing the physical assessment, but you'll also be asking them about their psychological health, their social health, and their spiritual health. So you'll be touching on all of those bases. Then you'll explain that you're going to move on to the physical assessment and then tell them what you're doing as you're assessing. And that doesn't mean that, you put the stethoscope to their heart and say, well, I'm listening to your heart now to make sure it's normal, it's regular rhythm, no murmurs. You don't want to be saying things like that to your patient. Just briefly say, now I'm going to listen to your heart. Now I'm going to go ahead and listen to your lungs. Take a deep breath in and out. Way back, I'm going to be taking a look at your abdomen now and pressing in your stomach area to see how things are feeling. Just very, very general wording as you're going through the assessment. Then you'll go ahead and excuse yourself and you'll go out and the provider will come in to see the patient, and then you're going to come back into the room. And you'll sit down again, and then you're going to ask if they understand what the diagnosis was that the provider has discussed with them. If there's any tests that you need to have explained, do they understand the rationale? Go ahead and educate the patient at that time. And then share the holistic plan, which I gave you the example with the concept model previously. And then encourage any questions that the patient may have. We've come to the end of our presentation. I hope that the information that was given to you is going to help you through this assignment. If you need more guidance, I can set up small groups and we will hang out to discuss further. Just send a request to the Ask the Professor board if you'd like to do that. Otherwise, ask general questions to the Ask the Professor board, and myself or your section faculty will help you. Please do not leave this assignment for the last minute. Start working on it today. Modules 3 and 4 require a lot of introspection, which takes a lot of energy, and you want to create space for that. In Module 3, you'll be doing your own health risk appraisal and writing a paper about that. And then in Module 4, you'll be taking that new self-awareness into your video holistic assessment. Integrated nursing is our future. This isn't all just fluff and stuff. Some of you may think it is, may think this course is really just a bunch of baloney, that it doesn't really carry over into the practice that you have today. But I'm here to tell you that a healthy, balanced, and self-aware nurse is needed to take care of our patients. It has always been needed. It's what some of us have lost since the days of Florence Nightingale. You are those nurses. You are our future integrated nurses. I will close with a Sanskrit phrase that I end my communications with often. That phrase is Ashe Salah, and it roughly translates as, so it is. Reflect on what has been said. Have a good day or evening, and please let us know if we can answer any questions.